Hello, guys. Welcome to today's episode to one of my physics series. So today we are going to be talking about some safety issues that relates to ultrasound technology. So ultrasound is a very common technology, but is one of the safest when compared to CT, X-ray, and some other modalities. However, there are some little safety concerns that needs to be considered if you want to ensure that there is no possibility of hazard. You have to consider these safety issues seriously. Though our machines are already made in a way to restrict and contain these kind of hazard from happening, and some of the presets you have in your machine are already doing that job for you. But it is very important that you pay attention to what we are going to talk about and see what you can do best with your machine in order to reduce or to maintain a very good professional practice in terms of safety issues. I highly recommend you go watch my previous tutorial on ultrasound knobology. Please do subscribe to my YouTube channel, follow me on Facebook and on Instagram at official at clinical imaging is the handle. Without much further ado, let's go ahead. So ultrasound we know is a form of energy, and energy converts from one form to another and does not get lost. So once you will apply this to ultrasound imaging, this is what we know as acoustic exposure. We are exposing the patient to acoustic energy. So, and how do we do that? It is with the use of the probe. This is the probe here, or the transducer here. Once this gets in contact with the patient's skin, energy is being emitted. Acoustic energy is being emitted into the patient's body. However, this acoustic energy is not as dangerous as X-ray. It's not as dangerous as CT scan, but there is still elements of uh, safety issues that needs to be maintained in order to make sure that we are discharging our duty with utmost diligence. So acoustic exposure is the amount of acoustic energy the patient receives during a scan. So if you are going to do a 10-minute scan, you are exposing the patient to ultrasound energy for 10 minutes and vice versa. So there are some of the acoustic output quantities that we need to understand, because if ultrasound is a form of energy, it needs to be measured. So these quantities are what we use to quantify the amount of energy that is going into the patient, the amount of energy or acoustic energy that gets delivered through the probe. And this is acoustic exposure, intensity, power, and pressure. They all have their they all have their units of measurement. Uh, so it's something we have to understand that sound relates to all the acoustic energy relates to all these acoustic output quantities. So, but out of all these, we are going to touch intensity a little bit, though in subsequent tutorials or lectures, I'm going to do much in explaining them one by one, because there are a lot of things that needs to be uh, done in order to do justice to each of these quantities. So, but for now, we are going to touch intensity a little bit. So if you look at the screen, you will see that there are different ultrasound intensities based on the mode or the ultrasound application you are using. We know that ultrasound have different modes: B mode, A mode, M mode, color Doppler mode, and so forth. So each mode of ultrasound you use has intensity, a particular intensity attached to it. That's why you need to pay attention. In the last lecture, I talked about looking at your screen to see the MI and TI values. So this is where that comes in handy. So if you're operating on real-time mode, on B mode image, or you have a B mode image, the intensity that you are meddling with at that point is between 1 to 200 milliwatt per cm squared. If you are using M mode, the intensity you are dealing with is between 70 to 130 milliwatt per cm squared. If you are activating the color Doppler mode, you are operating at an intensity level of 10 to 230 milliwatt per cm squared. Then if you are using a pulse Doppler mode, you are operating between 20 to 290 milliwatt per cm squared. If you take a look closely, you will understand that grayscale has lower intensity than M mode, and M mode has lower intensity than color, and color has lower intensity than pulse. So pulse wave Doppler emits the highest intensity in ultrasound, while real time or B mode or grayscale mode, B mode, B mode utilizes the lowest intensity level. Continuous wave Doppler is lower than the pulse wave Doppler. Pulse wave Doppler is the highest. So this is the reason why you have to ask yourself, that patient that wants me to uh, uh, demonstrate or give her the heart sound of the baby, is it right for me to do it at this point? So you have to ask yourself that question, because if you are actually using pulse wave Doppler in a first trimester, then you are doing it very wrong. You are doing something wrong there, because the intensity is very high. I recommend pulse wave Doppler not to be used except you are doing fetal echocardiography. So you have to be very careful with the mode of ultrasound that you are using, especially in obstetrical scan or while scanning neonates and pediatric patients. It may not matter so much with adult patients, but with these patients I mentioned, neonates, obstetrics, and pediatrics, you have to be very careful. There are a lot of ways to do this. Already, the manufacturer gives us a preset that have the MI values that is suited for these particular patients. So is it's not reasonable for you to be scanning a pediatric patient with an abdominal preset meant for an adult. Why do I say so? Because if you check the MI value and the TI value, they will not be the same. So it's best to scan neonate with neonate preset, scan pediatric patient with pediatric preset, scan OBS with OBS preset. So it can actually hurt, it can actually be harmful if we use improper intensity values for some studies. FDA recommends that all mechanical index values should be kept below 1.9. So if you are doing neonate and obstetrical study, make sure that you are operating between the range of zero point 0.0 to 0.03, 0 to 0.3, which is consistently safe. So if you are operating above that, maybe you are within the range of 0.3 to 0.7, is I encourage you to watch your MI values and TI values and make sure that you reduce your scan time, because there is possibility of minor neonatal lung or intestinal damage if your scan time is not minimized. So we wouldn't want that to happen. So if you don't want that to happen, you have to keep your scan time short. So if you're also using contrast ultrasound, you have to make sure that your MI values is below zero point 0.7, because once it's above zero point 0.7, there is a risk of cavitation. Cavitation is a topic for discussion in future lessons. We are going to talk about it, but to be a short explanation is that cavitation is an interaction that happens that leads to destruction of tissues in the body. And one of the things that can cause that is high mechanical in the high intensity values. If we are operating at high intensity, high ultrasound energy intensities, it can lead to these kind of occurrence. So cavitation can happen when sound intensities are above 3300. So some biological effects are possible to happen if we are operating above 100 milliwatt per cm squared. Why that is not possible, or it is consistently okay if we are operating below this range. So as for thermal index, there are things that we should bear in mind. If we are operating above 39 degrees centigrade, there are determined or biological effects that are possible within this range. And if we are above 41 degrees centigrade, that is dangerous to the baby if it's an obstetrical scan. So exposure should not exceed 33 continuous minutes, because if we do exceed this time, scan time, the possibility of thermal damage to the brain is there. So we should avoid it. So this again is what I showed in the previous tutorial. Uh, this is my machine, Siemens. So this is where the TIS, TIB, MI, TIS is tissue, thermal index soft tissue, TIB thermal index bone, MI mechanical index. These are where the indicators are. These are just indicators of how much intensities that the machine is producing. So they are to guide us on how to operate. So if our TI or MI are very high, we have to do something in order to reduce it. We have to optimize and make sure that we operate based on a LARA as low as reasonably achievable. So that will be it for today. Thank you guys for coming around. Please subscribe to my YouTube channel. Follow me on Facebook and on Instagram. The handle is at Clinical Imaging. Turn on notification for more content from me. You can share this with your friend. Thank you so much for coming around. See you guys next time.